Hello and good afternoon. My name is Christian Dorsey, and I'd like to welcome you to our live updates on COVID-19. I will moderate our town hall this afternoon, and I'm pleased to be joined by my colleague, Board Chair Libby Garvey. And we also have several members of the county's executive leadership team in attendance for the town hall. Jim Schwartz, our Deputy County Manager, Dr. Aaron Miller, the Director of Emergency Management, and Dr. Ruben Varghese, Director of Public Health. So we'd like to thank everyone for joining us as we continue to host these weekly discussions with the community on Facebook Live, and we're thankful for your continued participation. Although our fight against COVID-19 is far from over, our community has remained active and engaged with one another, from food deliveries and making face coverings to clapping for our healthcare heroes every Monday, and events like our recent town hall address the impact of the coronavirus on the decennial census. Business does continue as usual with our county government despite the emergency, and we are pleased to announce that today we opened our application process for our small business grants. As you may recall from a previous town hall, grants of up to $10,000 are available to Arlington-based businesses and nonprofits with fewer than 50 employees who've experienced direct impacts as a result of the social distancing restrictions and the stay-at-home orders associated with our response to the pandemic. Applications will be accepted through May 17th, and there are excellent resources and webinars along with guidelines that are available at arlingtoneconomicdevelopment.com for businesses looking to participate. Now, our community does continue to progress in the fight against COVID-19, but there remain challenging days ahead of us as the number of new cases continues to grow in Virginia and in the National Capital Region. We currently have nearly 34,000 cases at last count in the region. And along with that, 1,400 fatalities. While in Arlington, our case count is 1,309, along with 48 COVID-19 related hospitalizations. And we've also experienced, unfortunately, 56 fatalities of Arlingtonians. It is important to note that Arlington, along with our sister jurisdictions in Northern Virginia, comprise more than half of all COVID-19 cases, as well as hospitalizations, and nearly half of all fatalities, despite the fact that we are a little more than a quarter of the state's population. The impact here is different because of our regional characteristics. It is essential that we continue to coordinate across borders to combat the virus and to plan for our eventual economic recovery, which won't simply begin when we, quote, reopen, unquote, but will only occur when we can safely reintegrate all of us into public and communal life. We live in an interconnected region where our residents cross our cities, counties, and states daily to live, work, play, and pray. Businesses large and small have storefronts and operations throughout our region. Germs don't recognize jurisdictional boundaries, and we must continue to coordinate policy implementation along with our regional neighbors. And let me give you just one example before I turn it over to Chair Garvey. If we consider the closing of bars and restaurants, if just one locality were to loosen restrictions and allow bars, for example, to reopen before other jurisdictions, those establishments would become magnets for patrons who could access them, which is very easy with our limited regional geography as well as great connectivity in the transportation network. And this could potentially cause the spread of the novel coronavirus across many jurisdictions and make it more difficult for public health officials to do the necessary testing and tracing to control any outbreaks. So with that, to give you an update on the very many conversations on regional cooperation and coordination, I'll turn it over to Libby Garvey.
Thank you so much, Christian. It's great to be here today, and it's great to have Doctors Varghese and Miller with us and Deputy Director Schwartz. I think the theme today is, everybody's thinking about reopening, and this is not, if I could sort of be an open and shut case. This is not going to be a simple thing, and I think cooperation and data, good data, are the themes of the day. So as we all know, good data is going to be crucial to our being able to know when and how we can begin to reopen our local economy. And while some data on cases we've got it, and we look at that data, because testing is still not very widespread and not very available as it needs to be, this is more of an indication of how we're doing. We do have solid numbers, of course, and that's like the number of patients we have in our hospitals and how that's increasing the number of patients in ICUs and how our protective equipment is going. So those are numbers and metrics that we watch very closely here. And I think, as we all know, last week, Governor Northam announced that he'd be announcing this week and probably later today sort of his plans for how we might start reopening the Commonwealth. And I think for a while, many of us were kind of nervous about this because there's a sense that perhaps the governor's looking at the Commonwealth as a whole, which he needs to do. But we all know that Northern Virginia is very different. And I have been working very closely with my colleagues in the region, the other mayors and chairs, and through the Northern Virginia Regional Commission. We have a phone call twice a week to try to make sure we're coordinating. We have the governor join us on those calls sometimes, as well as our federal representatives. And yesterday we had a very good call with the governor and his team. And he made it pretty clear and made us all feel fairly reassured that he understands how unique Northern Virginia is with our density and the amount of cases we've got. And that when he makes this announcement, there's going to be an understanding and some flexibility for us to do what we need to do depending on the data that we've got. He has said that he's got some metrics that he's going to be looking at. One of them is he wants to see a downward trend in the percentage of positive cases over 14 days. He also wants to see a downward trend in hospitalizations over 14 days. And we need increased testing and an ability to do more contact tracing. Finally, we've got to be looking to make sure we have enough hospital beds and intensive care capacity, as well as an increasing and sustainable supply of personal protective equipment. So those are the metrics he's got, and I'm pleased that they're going to be looking differentially at the state, because I think the numbers, particularly on the trends, will be different for Northern Virginia than it will be for other parts of the state. So we will see what's going to be happening. And as Christian, as you said, it's really essential that we coordinate across our borders. I think everybody's understanding this. We live in an interconnected region, and we really are only going to be as healthy as the jurisdictions around us, because the germs just keep moving. So not only I'm working with the Northern Virginia Regional Commission, you, Christian, are working, I know, with our colleagues in DC and Maryland through the Council of Governments, as well as the Northern Virginia region. And I know our staff are working extensively all around the national capital region, which is really crucial. I think we all realize that this virus, if there's a weakness somewhere in this region, the virus will find it and take advantage of it. And we've got to make sure that we are uniformly strong and uniformly using the same metrics and the same standards to try as we gradually reopen, and look at also probably doing things differently in different sectors. And with that, I think I might turn it back to you, Chair Dorsey. I think people have probably got a lot of questions they want to ask, and I look forward to getting the questions and talking about it.
Thank you. So we are now going to begin with questions, and we encourage those who are watching to submit questions. You can either do so through the Facebook chat box, or you can also send us a text message at 571-348-3053. We have a number of questions that have come in already. Before we get to those, though, I want to provide a framing question that I'd like for Dr. Varghese to answer. Cases in Arlington have increased nearly 5-fold over the last month. They've increased by a little bit more of a rapid rate for the national capital region. Other data points show that there's been a slower spread of the virus in our region than in other places. The point is, with so many data points out there, what do you recommend that our public focus on in assessing how we're doing in managing the pandemic?
Thank you, Christian. It's an excellent question, and what I've tried to point out to many people in the large scheme is that in many ways we won't know when the official peak is hit until we see numbers consistently come down. And maybe that's a rather obvious thing, and I just want to make sure people actually realize that is something that we really need to be thinking about. I'm going to put up a slide first, and if I can, if it works here. And Christian, do you see this slide on the screen?
We don't have it yet, Ruben, but it may take a second for you to share it.
Just want to make sure that anything yet?
I'm not seeing it.
All right, well then let me just make sure I did the right thing.
There we go, it's coming.
Okay.
There we go.
All right.
Got it.
I just had to follow instructions, so there you go. All right, I will. Okay, so what people should be seeing on the screen now is some graphs in purple. And on the vertical axis, you'll see daily number of cases, and then on the horizontal axis, number of days since the first case. The big purple bump is, imagine this as an outbreak with no interventions at all. So you have a virgin population who's never seen the infection, they get exposed, they don't separate in any way, they continue to expose each other, and eventually you get to the top of this curve, but it's one of these things where you have to realize without interventions, the virus has to go through the community before it's going to burn out. If you look at some of the things we can do, what if we put interventions in place? So to reduce that peak, some of the things that we've been asking the public to do, first of all, are the physical or the personal hygiene habits, washing your hands, covering your cough, cleaning surfaces at home, staying home when ill. Combine that with now some of the societal hygiene habits that we've been asking, the governor's stay-at-home order, wearing face coverings in public. Those two different things help to what we do flatten the curve. And what people have to recognize is flattening the curve does not mean stamping out the curve. And so we're going to still see cases happen, but they're going to be pushed along over a greater period of time while these interventions still have to happen. So with that sort of concept, we're trying the best we can to put those pieces together. I think people, a question behind the question that Christian, you asked me was, what should the public look at? And I will tell people what I'm looking at. And I'm hoping that's eventually going to pop up on the screen here as well.
It is.
Yep. Yeah,
Okay,
we see a
so-
chart with green and pink.
Okay, good. Hasn't changed on something else, so I just wanted to make sure. So it's a lot of busy data. What I want people to roughly look at, I've asked staff to look at the hospitalizations in Northern Virginia, all of Virginia, and the middle column is the portion outside of Northern Virginia, and looking at the data for a 14-day period. And basically what we're trying to see, which is not a rocket science, is are we seeing a decrease in the inpatient hospitalizations related to COVID? And for the Northern Virginia area, there have been days where we've actually seen less than the day before, which is the trend we'd like. But there are days when we go back to having it go above, the previous day. Obviously, we'd like to see consistently over a 14-day period, the numbers either staying the same or declining. So this is kind of a curve within a curve. So Christian, you'd asked me about what I'm looking at to predict trends. When I see this becoming all green, or that's my desire, but at least all yellow first, which means there's no change, then it means it's a solid plateau. Then as we see the numbers decreasing, this would be a way to say that the severity of the illness, which is hospitalizations, is also an indirect way of saying that the volume of disease out in the community is also lowering, because hospitalizations can't occur without there being cases in the community, and we still have community-wide transmission. And that is why we are still saying all of the things we've done, we need to continue to do, because we know not everyone can stay at home. And that may be a good way to eventually talk about the zip code data. So I'm going to leave it there.
Thank you very much, Ruben. We appreciate it. So let's get to a number of questions that we've got coming from our community, both via chat and on Facebook Live. So why don't we stay with sort of the public health areas of testing. There are a lot of questions about testing and its availability. And I want to speak specifically to one person who notes that they have a vulnerable family member who has been showing symptoms, but has nonetheless been denied COVID-19 tests. And there's confusion about what is required to get a test if you are symptomatic, and why would it be difficult for someone who is vulnerable in a vulnerable population to get access if they are showing symptoms? Any insights, Dr. Varghese?
Sure. Obviously, people with symptoms have been prioritized for testing wherever they can find testing. So they can actually go to the hospitals, the Virginia hospital site set up with Arlington County at the Quincy Street site, but that would have to be a drive-through model. All they'd have to do is actually get a prescription from their doctor, or using the hospital to screen, they can do that as well. They just can't show up that day. They have to be scheduled for that. Other places like Inova are providing that testing at their sites. One of the things that we're trying to do is also move from the from a car model to a walk-up model, and that's what we're trying to do with hopefully a soft launch on the south side of town as well. So there are tests out there. It's just that finding them are not as easy because we have to still, there's a supply chain issue. So I would have the caller or the texter check with a hospital and their own doctor. If they get a prescription, they should be able to schedule the test at that site.
Could I follow up with a question, Christian? Dr. Varghese, because we get questions kind of along this line. Could say we decide there's a group of people that we want to test, maybe in a nursing home, maybe it could be like a school, you know, the teacher. Can we just test whoever? Can we just decide here in Arlington County we want all of these people tested and have them tested?
Great question. It's a complicated answer, but we would like to be able to do more testing, but there's a limited capacity. So we've been working with the Virginia Department of Health and the state. They have resources through the Virginia National Guard, so that if we need to do, say, facility-wide testing, we put in requests for that, and then they have to schedule those things to be done. They will likely prioritize the requests because it's a limited resource for the whole state, and so they'll prioritize places maybe with at risk for an outbreak, or trying to help change recommendations at a facility. As far as we know, no schools are open at the moment, so that should not be an issue. But also jails are prioritized and have had those things happen. Having said that, I know the hospital has worked with a number of the facilities to do testing as they request. We have on occasion gone into facilities to help diagnose one or two of the first cases, so we can help declare whether there's an outbreak or not, because that's an important thing for us to do. We don't then try to identify every single person because we have limited resources, but we then put infection control recommendations to those facilities, and then that's what we monitor in that process. I hope that helps.
That's helpful. No, because I think there's some misunderstanding that we have to kind of ask the state. I mean, they listen to us, right? And we have a lot of influence, which is good. But right. You don't just decide, Dr. Varghese, that these people need to be tested. You need to work through the state to make that happen.
Through the state, and then facilities have to actually agree to these things as well. It is not just a that Dr. Varghese can order this, that, or the other thing. That's not something that any of my health director colleagues have as a authority in Virginia.
Thank you. I think that's kind of confusing to people because they sort of assume, I would assume, that we could just sort of do this, but we can't quite just do it. Thank you.
So along those lines, there are lots of testing questions, particularly Dr. Varghese. You know, if you see a point at which testing will be available for asymptomatic people as part of a public health strategy to manage our risk, and then two, if that's not going to be possible and not going to be made available, what are the key indicators in testing that you're going to look to if we can't broadly test everyone?
Sure, and I'll ask Aaron to chime in afterwards if he's got any additional things, as well as Jim Schwartz. Testing is an important thing to ultimately do, and the reality is we don't have as much testing nationwide, Virginia-wide, or Arlington-wide, or in the National Capital Region. It's the reality. The supply chain for all of these things has to be grown, and every day that capacity increases, but we're not to where we would like to have testing. And ultimately, we have to eventually have vaccine to be able to really get away from the physical distancing and face covering recommendations we're going to ask people to do from now, even with whatever level of reopening we do. So that's kind of the important thing to look at. Having said that, without the testing information, in some ways, it is some of the things that I've already talked about. We will look at things like the hospitalization information, how many people are ill that we have reports on, and eventually, as the numbers increase in testing, how many of the tests end up being negative rather than positive. But that requires a lot more testing to be available in the community for us to be able to start seeing that we start seeing a high number of tests being done and representatively across the county and the region, and then still seeing them being negative. Aaron, is there anything you'd like to add?
Ruben, I think there was, I want to emphasize a point that you made earlier, and that was sort of how the Virginia Department of Health criteria has evolved and changed based on the supply chain of testing that has become available. I want to point people this week earlier, the governor, in part of announcing a new strategy around testing, laid out what is called, and you can find this on the Virginia Department of Health website, and we'll provide the link in the chat box. It is the recommendations and prioritization for testing. And it lays out the Commonwealth strategy for using its public health lab assets and those at Virginia Commonwealth, Virginia Tech, the Division of Consolidated Laboratory Services, and the private lab providers. And I think, that strategy outlines answers to some of the questions that people may have about things which we call in public health and emergency management sentinel surveillance, right? Widespread testing and public health monitoring. And then as well, how testing is being approached for at-risk populations. Two pieces of the puzzle that I want to add to Ruben's discussion is the state has recently received and will receive for the months of May and June, over 200,000 additional test kits that the Virginia Department of Health will be able to use. This is supplemental from the CDC, and over 175,000 transport mediums. And so sort of the goal is, as Ruben mentioned, to stabilize the supply chain and testing resources. So over the next 2 months, we have this backstop. And then localities like Arlington are working with the state to establish and expand our own capacity where we're able. And the walk-up testing site is a great example of how we are working to do that and provide more access for the community.
Thank you. And Aaron, why don't we stay with you, because we're going to get into a lot of questions about masks and mask use. Good. And maybe if we can sort of talk about where we stand with the current science and guidance on the use of face coverings, where they're most effective, where they're most necessary, and how should people respond if their environments out in public or within their multifamily buildings, for example, where someone doesn't have a face cover?
Sure, great question. I think we've been fortunate enough to cover this in a number of town halls, but I think this is one of the important things that we can hit. Our public health professionals continue to recommend that wearing a mask in public, wearing a cloth face covering in particular, is very important, not only to protect yourself, but also other people. So this is about spreading germs. As many folks have mentioned in the chat, there are concerns of asymptomatic transmission. So having that cloth face covering does help reduce transmission. So keeping that social distance is the other key to that. So that 6 feet distance and maintaining the appropriate distances while in public. Dr. Varghese said this last week. I have my cloth mask here. I wear this cloth mask every time I step out of my office door. So I'm in my office right now, obviously just me. When I step out, even into the common areas of my office, when I'm in the hallways of our buildings, and when I go in public, I have this or another cloth mask. I actually have two with me, one that I keep in my car. Um, so that's what I would say. If you're in a multifamily dwelling, you're out in public, as soon as you leave what is considered your sort of private space, so whether that's your room, your office, your apartment, you should be wearing that cloth mask to protect not only yourself, but also the rest of the community. And maintaining those distances are key and critical to the continued public health strategy. Those are the reasons that we've been able to see this flattening of the curve that Ruben mentioned. And as we have discussions of people going back into public and resuming activity, they're a key component of the strategy. It's not one or the other. All of these things are fundamental building blocks to keep the community safe.
Can we follow up on that a little bit, Aaron, if you would? I've got my mask here too. Because we got a question. If everybody wore masks whenever they were outside their home, would that mean the virus would go away in a couple of weeks? I know the answer, but if you could elaborate as what different things happen, okay?
So I'll let Ruben speak more specifically, but this is I'll say this: the virus is not just going to magically go away. We know that there are a lot of things that have to happen, particularly vaccine development, as Dr. Verghese mentioned, but also more research on therapeutics that can help us understand better how to treat this. However, there are a number of studies, and public health has shown throughout decades and decades of research that wearing these face coverings, should large portions of the population wear these face coverings, we can bring down the transmission rate of viruses from individuals spreading germs. And it's not just through this particular virus. It's proven from flu, it's proven from cold, it's proven from a number of other respiratory viruses that having these simple face coverings can reduce transmission to manageable amounts. And that's what's important about what Ruben mentioned. It's about continuing to manage the impact and make sure that our healthcare system, as well as everyone out there, can handle the impacts of the virus. So, Dr. Verghese?
Sure. Very little that I can add there. Excellent. But just as the visualist, people may think about, if you've ever seen pictures of people coughing or sneezing and seeing what comes out, when they do the special photography, what these masks do in many ways is you're reducing the volume of germs that are going out into the atmosphere, landing on surfaces. Okay, so that helps. But as Aaron also said, still stuff is going to come out. These are not airtight things, because if they're airtight, we can't breathe. Anyone who wants to wear an N95 all day long, I welcome their trying it. It is not the easiest thing to do. That's why we're also, other than just recommending it for healthcare workers and EMS, there are practical reasons. But Libby, as you've pointed out, this is a way to help lower the curve, reduce the volume of germs, buying us more time, as Aaron said, till we get to better treatments and ultimately to the day with a vaccine to be able to come out of having to do this.
Christian,
And just to be clear, the next dimension of this is people wondering whether or not the local government is going to mandate the use of masks. And I want to assure
Christian,
people.
you and I are the same wavelength. That's where I was going to hit. Thank you.
Excellent.
Yep.
So that is actively under consideration, and we're looking at the best ways to pursue that. And we recognize that for some people, until it comes with the government imprimatur of being a mandate, they're not going to do it. But we also have to be mindful that once something is mandated, we have to have an effective way to enforce it, which is another dimension that requires some considered thought. But we do want the message overall for people to understand that we want to also make sure that issues of mask availability are not an issue. So we've stood up a task force to make sure that we can make these cloth-based coverings available to people who don't have an easy means to either get them or make them, and that we create the culture of voluntary compliance, that we figure out what's the best way that government can affect people to comply through some sort of a mandate, but that also that our enforcement makes sense and that we don't put ourselves in a position that unfortunately we've seen in other communities when various officials have tried to enforce social distancing restrictions. They've been met with violence, harassment, and even in some cases being killed. So we don't want that obviously to happen here. So we are taking an approach to make sure we can do it effectively to protect everyone in the ways that have been described. Anything else to add, Libby?
I was going to wonder if maybe Jim Schwartz would like to talk a little bit about our experience with enforcement. There's the mask issue, there's Parks and Rec, and I know he's been working on that, and any trends and that he's seeing and comments he might like to make.
Thank you, Madam. Yes, thank you, Madam Chair. So we are actively out in the community. When I say we, I mean our park staff and the police department, but sort of in keeping with Mr. Dorsey's comments, we are encouraging people. We are, I would call it kind of a soft enforcement. We're not in a position to be citing people the way we might for a traffic violation or that sort of thing. So we're really trying to just encourage people to follow these good practices and not have the heavy hand of government imposed here.
All right, thank you. And one last question asked, should people wash their masks, the cloth ones? I think the answer is yes. How often? Anybody?
Well, the recommendation is if you're going to use the same mask, you should be washing it every single day. Obviously, if you have a supply of other material, remember, a lot of people think they need something with loops and so on. All you need is a bandana tied around your face would qualify. And if you're going to reuse it, then you need to wash it every day.
Thank you.
Why don't we stay with the science for a little bit? We have some questions about what has changed in terms of what constitutes symptomatic patterns for COVID-19. At the beginning, there was a lot of talk about fever, and news since has shown not only that there are many asymptomatic carriers, but the symptoms themselves have changed. What should the public be looking out for with their own health for determining whether or not they need to seek COVID-related medical attention?
Sure. Good question. So what we learned from abroad was we focused on things like fever, cough, and shortness of breath or difficulty breathing. That was what was originally coming out. And we have the benefit of being able to put in more systems in place as a nation to collect more data. And so we're able to learn more as we've been dealing with this crisis. And so as all the contact information, the case identifications we've done here in Arlington and elsewhere, all of that information gets summarized and is sent to the CDC. And as they recognize, there are more things than fever, cough, and shortness of breath that seem to be associated. Chills, muscle pain, sore throat, and also including a new loss of taste or smell. Others less frequently are reporting things like GI symptoms like nausea, vomiting, and diarrhea. None of this is unusual in one sense because the body can only respond in certain ways with a virus, but this is a virus that apparently now has both respiratory and some non-respiratory symptoms, and that's a little bit different for most things as we learn more about it. Having said that, Christian, one of the things we talked about, and it's why we sent out the mailer to the households, just because you have these symptoms doesn't mean you have to go get testing done. I understand that people want to know, but they need to realize that what we're recommending at this time is if you can, you stay home, you rest, get the support you need to be able to recover from this, because the vast majority of people will recover. The value of testing from an individual perspective is if you eventually need to be hospitalized, where they'll do the testing as well, it may qualify people for special compassionate use of medications that are traditionally used for other conditions to get that permission to use it. But it may seem like it's doublespeak saying, don't we need more testing? And I'm going to say yes, but any one individual, they shouldn't get so worked up and start worrying that because they don't have a test, something as bad is going to happen. Looking at the larger picture, we've told doctors you can make a clinical as opposed to a laboratory diagnosis, and encourage people to still follow the recommendations we've made and seek care if you're not getting better.
Okay. Let's turn a little bit to some of the questions that we have on reopening and a reopening strategy. And so maybe we start at the 25,000 foot level. And what are the Arlington specific issues and needs and concerns that we are looking at when determining when it is safe and practical to reopen from some of our restrictions? Mr. Jim Schwartz, why don't you start us off with that high level approach?
Thank you, Mr. Dorsey. So this is actually a topic that has engaged the county manager and his executive leadership team for the better part of the last couple of weeks. Now, that conversation is mostly driven around how we begin to look at the restoration of some of our services and the potential to continue doing some business the way that we have over the course of the last 7 or 8 weeks. What has worked and what we can continue to apply to our providing services in the community. In the terms of the broader community, obviously we're going to be informed by the governor's actions. As was alluded to earlier, we expect some more information later today from the governor as to how he is seeing things. A key point in the governor's change of view has been that there seems to be an understanding now that the Northern Virginia region, who, as we've already indicated, has been more affected by the virus than other parts of Virginia, at least to date, will in all likelihood be allowed to measure our reopening at a different pace than the rest of the state. The county manager, Mark Schwartz, is actually on a regional call as we speak with his colleagues as they are looking to how that would be coordinated across the Northern Virginia region. So we're looking at a lot of this. We're trying to come up with ways that would both protect the public as we provide services to them, and certainly our workforce when we're talking about the restarting of some of the ways that we provide services. And then I'll let Aaron would be good to follow on that.
Sure. So as Jim mentioned, the leadership team across the county has been looking at this from a policy standpoint, but those of us in the emergency operations, emergency management world have been looking to coordinate not only what that means as far as resources and supplies, so whether that is what additional disinfectant and cleaning materials we need to be cognizant of cleaning public spaces more often, whether it is what supplies do we need to provide our employees, including face coverings and other personal protective equipment. And more importantly, what lessons have we learned from the last several months? As the chair said, and as Mr. Dorsey said, government has not stopped. We're still delivering vital services and critical services for our community. Everything from crisis intervention and behavioral and mental health to food and rental assistance for those members of our community who are having an especially tough time with this disaster. We know that those needs are going to continue, and it's important for us to ensure that we have continuity of those services and determining ways in which we can continue to deliver those services in a quote new world, right, in a new fashion. And you know, I think it's just as important for those of you in the community to know that we take that seriously and as a focus, and work with us to provide feedback in those particular areas to how we can better deliver some of these services and partner with the community in those regards.
I had a question, Christian, just to kind of, and I don't know who this is for, because you know we're obviously doing a lot of things, and thank you, Aaron, for that, because I think we are really rethinking what we do and how we do it. Are we going to be giving guidance to our business community and the rest of the community? I know the The governor is looking at breaking out his guidance along sectors. So in other words, there's the restaurant and beverage sector, those kinds of things. There are retail where it's bricks and mortar. That's different from gyms, from personal care. There are all these different levels. Beaches, I think, is the one we maybe don't have to worry about, but we do have pools. So are we going to be providing some guidance by specific, I don't know, sectors, quite the way of doing it, because different kinds of businesses and organizations handle people differently, so the virus will behave differently. Any thoughts of what kind of guidance we might be providing there?
Yeah, so wonderful question, and yes, we actually had talked about this the last couple of days based upon what the governor's framework looked like. So I'll give a good shout out to our Arlington Economic Development partners, and the team there has worked throughout this to provide guidance, as we mentioned, things like grant opportunities for our small businesses that have been impacted. But yes, we're working to not only take the CDC best practices, and for those that are familiar with this, OSHA, the Occupational Safety and Health Administration, released new guidance on protecting workers in the workplace. So we're taking documents like those, and as they are developed, and helping to translate those best practices for our community. We are working to develop some of those resources, and will include things like this, right? Town halls or virtual opportunities. Dr. Varghese and I talked about this, sort of, chances for those sectors or those businesses within Arlington to ask a public health professional. I thought about it like office hours that we used to have with teachers, right? Have an opportunity for those businesses in those sectors to ask questions of our local workforce and our subject matter experts to help them out. So yes, we are looking at that, and want to be able to roll those out in concert with what the governor announces, for instance, today, once we have more information on what his framework is going to be.
Thank you. And I know I would say one of the things we're looking at ways we can adapt. I think one of the things we're looking at is longer hours. So I think that's great. The doctor is in for consultations, as you mentioned, Aaron. If people have got questions that, we might, 9 to 5 is probably not going to do it. So that's great. Thank you. Dr. Varghese, did you want to say something? Excuse me for interrupting.
No, nothing here.
All right.
Well, why don't we stay here for a minute, because we do have some questions about how the governor's plans for reopening interact with Arlington's own local authority to operate within an emergency. And if I could frame it and maybe turn it over to Jim Schwartz to bring further context to it. But the way that we operate in Virginia is that the governor, through his executive orders, has the effect of instituting laws that are applicable to the entire state, including Arlington. That fundamental fact does not change during an emergency. While we, during the course of our local emergency, have much broader authorities than we would have normally, those do not go up to conflicting with executive orders issued by the governor. And in the case of closing of certain businesses, the executive order that we are operating under as of right now permits businesses that are not considered, not explicitly designated to close. It allows businesses to operate provided that social distancing is implemented. And it is our understanding as the legislative body that instituting ordinances that violate, that are contrary to that, are not within our purview. So our approach is to hopefully give the governor, or have the governor, provide us the latitude through his broad executive orders for the state. Anything you want to add to that, Mr. Schwartz?
No, I think you hit it very well, Mr. Dorsey. This is just a matter of us taking the governor's orders and implementing them at the local level in a way that, quite frankly, he's not being as specific in detail that we will take to, put our government operations into practice.
And then, Christian, I'd like to just build on this a little bit back to where we started, which it's not only the governor and us, then we're working with the region again, so that we may come up with some things. And I don't know if Mr. Schwartz or Dr. Varghese or Aaron want to talk about that at all. But I think there's so many different levels of coordination. It won't work unless we do that. So I know people sometimes wonder why we can't give just a real clear answer. We're going to do this, but we've got a lot of different things to consider.
No, I think, Madam Chair,
Indeed.
you're exactly right. That's why we participate in the Council of Governments. It's why we participate in the Northern Virginia Regional Commission. It's why every day Dr. Varghese is on multiple calls with his colleagues across both Northern Virginia and the Commonwealth, so that we are coordinating our activities. We are not stepping out in a way that sends a signal to our respective citizenries that what we're doing in Arlington is somehow out of alignment with what our partners right across a jurisdictional boundary that, as was alluded to before, does not pose a barrier to the transmission of the virus.
Thank you.
Okay. We do have a question about the economic health of our county as we manage this crisis. What economic indicators are we using to gauge our financial health? I'll kick us off, and then certainly Libby, Jim, add in where you feel appropriate. Overall, when you consider the biggest issue that we are facing as a result of this is the dramatic increase in unemployment. And those numbers, while I do not have them off the top of my head, it is an exponential increase in unemployment from the start of the crisis to now, where weekly unemployment claims were in the teens. As a regular course of business pre-restrictions, they are now in the thousands of new unemployment claims every week. It is incredibly severe. When you look at the overall rate of unemployment as a result of COVID, Arlington and Northern Virginia as well are better situated than other parts of our Commonwealth. So relatively, we are in an okay place economically, but that's relative to others during the pandemic. Relative to where we were at the start, this is incredibly severe. We certainly see the impact on our budget in anticipated revenues for fiscal year 21, where we just passed a budget to fill a $56 million revenue hole, and that's something that we were able to manage thoughtfully, I believe. But to put it in an overall perspective, you look at unemployment, you look at the impact on revenues that come from taxes generated locally, you look at the amount of people who are able to stay in hotels. Hotel occupancy rates are down to unprecedentedly low numbers. We have some severe economic stress, and it's going to take a while to dig our way out of it.
Thank you. And Christian, you started off at the beginning talking about the grant program that we're working on to try to give loans and outright grants to businesses to keep going. And sometimes that's a bridge, hopefully, to getting to some federal support that may come in. But we really want to keep our businesses going. And I'm really pleased the way the community's been stepping up, because we had a grant program that we just repurposed and immediately moved the funds into this new program to help during the pandemic. And I think it was the Crystal City bid, I think, immediately jumped in and provided some more funds, and some other organizations have been doing that as well. I think this whole community realizes that we've got to keep everybody going to get us to the other side. And then one of the programs I've mentioned before, which I think will be very significant for our commercial real estate, is how we're handling the real estate taxes. So some companies actually pay while homeowners have monthly payments, and some may be having problems and can avail themselves of this program. And a lot of its businesses, they may wait until June to pay, their 6 months of their tax bill, which can be quite significant, and suddenly find they don't have the resources to do that. So our treasurer has a taxpayer assistance program. And I know while some jurisdictions, and we've gotten some pressure to actually just delay the taxes, don't collect them in June, collect them in July. This is going on for a long time. So a month delay is not going to do it. And what we need is something that's going to be more structural. And I think in many ways, this TAP program really can help. It allows that you pay 10% of your tax. So you don't have to pay the whole thing, just 10% of it. And then we're working through John Marshall Bank. They pay us the taxes, and then the businesses or individuals pay back to the bank over 10 months. So you've got 10 months to spread it out, which makes it much more doable, particularly for commercial establishments. And we still get the money to continue operating the county, which we have to do, and it keeps it all from grinding to a halt. So those are a couple of the things that we're doing. And this is certainly as much an economic crisis as it is a health crisis. But you can't separate them. I'll stop. And we are getting pressure. Just open up. Just open up. And you hear that. Well, if people are getting sick and companies can't run because their workers are sick or people are afraid to come in, the economy's not going to do well. We've got to deal with the underlying issue, which is this disease. So I've talked along a lot. Sorry, it's a big issue though.
It's terrific. We're going to move to an area of issues around specific elements that have been restricted to use or otherwise closed, and where they may fall within the hierarchy for reopening. So maybe Jim Schwartz can start us off. And the questions specifically are looking at parks and outdoor facilities. What we're going to do in terms of basketball courts and tennis courts, and where they may fall if we're going to take a phased approach to reopening. What will be the guidance? That's part one. Part two, what will be the guidance for use of trails and park facilities as it relates to masks, understanding that it may be difficult to engage in physical exertion while wearing a face covering? And then third, if you can remember all of this, when we think about our public facilities, are we going to do anything differently to disinfect and monitor areas and surfaces that are used by lots of different people? For example, shared use restrooms between employees and the public. Give us any of your thinking on that, understanding you won't be held to any firm decisions.
Yeah, so thank you, Mr. Dorsey. In terms of, at a high level and maybe context setting, the manager has been very clear with senior staff and actually with the entire, we did an employee town hall just a couple of days ago, that we will not be opening anything back up. And again, I'm always trying to look for the right words here because with the exception of some things like parks, some of our amenities that have been closed, government has largely been open and providing services, especially those essential services that Dr. Miller alluded to earlier. But what the manager has said is that we will not begin the process of restoring some of those other services, including parks, before the month of June. And in fact, as late as this morning, the parks director was saying that in her conversations with her colleagues across the region, it looks like they are focused on the June 10th date that the governor set for his initial closures, and that would be a date that they are currently looking at across Northern Virginia to reset parks. Now, when we do that, and it isn't just parks, it's all of our facilities, we have to gear up for that issue of cleaning, disinfecting spaces, that sort of thing. And that actually was another portion of our conversation as late as this morning with the executive leadership team. Our Department of Environmental Services is leading a multi-department team that is looking at all of those issues, both within our buildings and then some of our other facilities. Think of a restroom at a park that might reopen in early June. How do we deal with that? This is a time, though, perhaps to reinforce the idea that we're not going to be able to disinfect the world, and people will potentially come in contact with the virus, despite our attempts to minimize that. And so we return once again to the important aspect of washing our hands with great frequency. If you touch a surface, it's going to be great that you disinfect that surface to the extent that you're possible. It's going to be just as important that you wash your hands after engaging with that surface. Think a restroom door, as was mentioned in the question. Let me stop there and see if I've hit everything that you asked. I'm sure I missed a couple of things.
Sorry there, Jim. I was on mute for a second. That is fine. Libby, do you want to add anything about some of your priorities for reopening in phases and what you'd like to see?
I think I'd pursue a little bit. We got one of the questions, somebody asking if this team has met yet with the new superintendent. And I don't know, but seeing as the new superintendent was appointed last night, I think I can safely say not yet. But I wonder if any of our gentlemen here would like to talk about the issue of schools and reopening at all. That obviously needs to be worked through with schools, but I think we're just starting to focus on how, if we need to continue the social distancing and things, this is going to affect how schools are going to reopen and handle things. So I don't know if people want to touch on that. And I did want to give a shout out to our libraries. Because they've got the COVID zine, I think it's called, or Panzine. Anyway, they're doing a lot of things online.
The quarantine.
Quarantine, thank you. I couldn't remember, which is great. But they also have repurposed, almost every employee with libraries is now working in food distribution. So, people think, well, you're not doing that, people are doing nothing. No, we are, as much as possible, repurposing people to allow us to, better respond to this virus and support our community. So I think that's just a shout out to our libraries for how well they are repurposing and handling this and helping everybody continuing during difficult times. But I don't know, Jim or Ruben or Aaron, if you want to talk about a little bit the issues you're kind of looking at with schools. I assume you haven't met with the new superintendent yet, but I imagine you will.
Yeah, let me start that, Chair Garvey. No, we've not met with the new superintendent as yet. The announcement of his selection was made this morning to the executive leadership team, but we were all pleased to see that he is starting quickly, that he'll be here at the beginning of June, and we look forward to a positive, a great working relationship as we have always had with the school system. I think in terms of the schools are likely going to have to do quite a bit, as the rest of government is doing, which is, as you pointed out with the library example, adapting a lot of how we are providing services. There have been some great examples of that across government. I will also say that we are very mindful, because we have employees that are in the same position, whether they live in Arlington or elsewhere in the region, that the restarting of schools, the restarting of childcare is going to be absolutely essential for us restarting, all of the services that the community is accustomed to, because the way the family dynamic works today, we have parents that depend on functioning school systems and childcare, the availability of childcare, in order to give us part of their day and come serve the citizens of Arlington. Let me turn it over to Aaron first to talk about the coordination with schools who have their own emergency manager, and some of the work that we do with them on a regular basis as we gear up for their reopen.
Sure. Briefly, I'll just note that, as Jim said, schools, Arlington Public Schools does have its own individual emergency management program and a lead for that. We have, through our framework, been coordinating with them on not only resources, so whether that is personal protective equipment for school officials and those that are continuing to conduct essential business, but also on a number of their programs and program delivery. And so I'll go to one of the things that we talked about a number of weeks ago on these town halls, the Cooperative for Hunger-Free Arlington. Obviously, that is a whole community effort. And as part of that, we are helping APS and supporting their sort of lines of business that go towards this. We're going to continue to, lean on our emergency management partners in APS for their input and track it very closely.
Thank you, Mr. Miller. And I believe we're also working on trying to provide more support and make sure that all the students are connected through the internet. Different ways to do that. That's going to be crucial.
Yeah, that's
Okay,
true, Harvey. Yep.
All right, terrific. So a few more questions. We'll try to knock some of these out quickly. Dr. Miller, has Arlington, Aaron, have we begun to track documentation to submit to FEMA for all forms of assistance that might be available to our locality?
Great question, and I appreciate my public assistance-minded folks that are out there. Yes, since day one, we have been tracking the necessary documents and have also supplemented what our capacity is with some contract capacity that is allowable and eligible for reimbursement by the federal government. The Commonwealth, as you know, acts as the primary submitter up to FEMA for reimbursement. And the county has provided all the information to date necessary for that. We are fighting hard with the Commonwealth to make this what's called a 100% funded disaster. That very rarely ever happens, but we're going to see what we can get. Now, an important part is something that I think has been mentioned. It's not only about what we can get through FEMA for public assistance and reimbursement. It's about the funding streams made available in the CARES Act. It's about the funding streams made available through CDBG money that the board obviously can help prioritize and set towards some of the needs that are there. But it's also money in HHS and other avenues. And one of our commitments as staff is to help provide all of that information to the board so that they can help inform the policy and develop guidance for us in how we best fit the assistance from the federal government to the area of need. Our goal is maximize eligibility and maximize allowability. And that's one of the things we're committed to doing in emergency management.
Thank you. And in some ways, we've had a lot of practice with that too. This the pandemic is new in its size, but we've had a lot of emergencies. We've worked through those, those structures for.
We had a question about real estate taxes and why they have increased during a time of crisis. So I'll frame this a little bit and then turn it over to Libby to add what you would like. But just to be clear, the county board with the budget that was most recently passed, which will cover the year beginning in July, beginning July 1st, does not call for an increase in the real estate tax rate. However, due to increased assessments over the previous calendar year, most bills for Arlington residential taxpayers will rise, not because of an increase in the rate, but because of an increase in values. And Arlington doesn't have flexibility to determine the value of a property. And remember, those values were assessed prior to COVID. So that is the nature of where we are from a tax perspective. It seems that most other jurisdictions in the region, not just in Virginia, but including the District of Columbia and Maryland, are either at a place of holding their tax rates steady, or I think some are even still proposing an increase, which is not something that we have done. And just to speak to the point of dealing with a crisis, we realize that there are lots of needs that emerge, whether it be housing insecurity, food insecurity, the assistance for small businesses that we've talked about. So to meet those needs and concerns, we've had really substantial levels of investment to ensure that we can provide direct assistance, cash assistance where necessary, smoothing out the expenses that people have over time, providing grants for businesses, et cetera. So we're trying to meet the needs as best we can. And with the tax rate, we did keep the tax rate steady. And while I know that many people would have loved to have seen a tax rate reduction, as we've talked about during this town hall, the functions and workings of government have continued throughout this crisis and will continue and will ultimately need to be paid for. And we do that primarily through the real estate tax rate.
Yeah, thank you. I think the only thing I'll add, and actually in some what you explained, is we're trying to be strategic. So when it comes to real estate taxes, we've got the TAP program I described earlier. We have a variety of programs for seniors and for others, and anyone having trouble paying their real estate taxes, just let the treasurer know. And she will work with people to the maximum amount that she is allowed to do that. But again, we provide a lot of really important services that our safety net is really stressed right now. And if we want to keep this community going, we can't stop government. We've got to keep it going. A lot of taxpayers are in the, don't have trouble. I'll use myself. I have a widow's pension and I've got my county board salary, which is continuing. Thank you. I can pay my real estate taxes. And there are a lot of people who are in positions where their work is continuing, their pay is continuing, they can pay their taxes. And we need to not just stop taxes for everybody because some people are having trouble, but others are not. We need to be very strategic in how we handle this. So We're still keeping the real estate taxes are how we fund government, which we have to keep going. But we are putting in place as much as we can, all kinds of supports for anyone who's having trouble with those taxes or having trouble with getting food or anything else. So it's just kind of the way it works. It'd be nice to not have to pay taxes, but we need the services that they provide. Thanks.
Indeed. So another question about parks, or a series of questions about parks. But what do we plan, Mr. Schwartz? You can start us off with this, in thinking about either soft enforcement, hard enforcement, and promoting, more importantly, promoting what are the best practices for behavior in those places where it's just really difficult to figure out your game plan. We've talked a lot about grocery stores and pharmacies and essential businesses where you can conceptualize 6 feet of distance, and in fact, they often help you with marking it for you. You can think about those masks indoors because it makes sense. But what are we going to communicate to people who may want to go out to a park to recreate and not sort of wear a mask, but then they could be placed into an environment where lots of people are around them? Not that they planned it, but it just happened. What are we planning on providing as far as guidance and education for the broader public on effective and safe use of park-like facilities when we do reopen?
Yeah, Mr. Dorsey, I would say that we've been messaging from the very beginning, and we have. I would say our messaging has evolved as guidance from CDC and from the Virginia Department of Health has also evolved. Many may remember that when we started, the concept of a cloth mask, any kind of a face covering, was not considered a routine. It was not part of our messaging because public health officials had not come to the conclusion that there was of great benefit there. So those kinds of things are evolving, and I think you're going to see an evolution in our messaging also. I can't tell you today that we have worked out exactly, to go back to your example of parks, when parks open, will all activities within parks be available to people? I don't think we have an answer to that yet. That's the kind of thing that we're still working on. It would be hard to conceive of 3-on-3 basketball in one of our, or at one of our facilities as early as the end of May or the beginning of June. But again, that's the kind of thing that we're continuing to work on. We'll continue to work with public health. And then our messaging will be hopefully, I expect that our messaging will be in both the traditional ways that we've been doing it and also more signage in facilities as a constant reminder to visitors to our facilities, what we hope for them, what kind of practices we hope for them to follow. Perhaps Dr. Varghese wants to add something to that.
Sure, I'm just turning up my camera. I know it's really tough for folks to stay put and not go out and interact as they have traditionally done. And the reminder here is the reason why we've been grateful that this message has been adopted by the county is we're trying to prevent that interaction of unrelated units being part of this discussion. So I know it's a really tough thing to do, and I'm grateful for everyone who's been cooperating, and we are working as hard as we can to figure out when it's safe to allow these things to happen, because we don't want to reopen only to close again. That would be even worse than not starting.
And I think we also, Christian, as you started off talking about, we're working more on the whole cloth covering and being able to provide masks to anybody who needs and wants them. And I think we're going to be kicking that off next week. And I don't know if we'll have mask dispensers at places or how we're going to handle it. But I think we're going to want to make sure that everybody's got a cloth covering. And you're talking about going to the park. I mean, I'm assuming I just carry mine in my pocket when I go out for a walk, because a lot of times I don't see anybody. But as soon as I start seeing people, I just pop it on. And I think happily masks are fairly small and easy to do. And I've had a daughter that's made me several, so I've got several. But anyway, I think there are a lot of masks in our future. I don't know what we're going to be like when we open up again. I don't know if anybody wants to, if that's a place to finish or not, Christian. Just like, what's the end point? I think we're not quite sure yet. So.
Yep. Well, I think that's we can certainly give some wrap-up comments on that, but I did want to get one more substantive question in there for Dr. Varghese, and it kind of takes us back to where we began. And look at that wonderful form and how to cough into the crook of your elbow. Nicely done, Doc. But if we want to think about testing again, so the concerns are from people who are chatting and texting in. Why in the world is Virginia so far behind in testing? And is this an issue where the Northern Virginia needs and concerns are so different from the state that we're not getting the level of testing that is required? And just is there anything that can be done on the local or regional level to break through what for all appearances is inadequate testing, given that we have heard that constant refrain all the time, testing, testing, testing?
Sure. Let me try to remind everyone what's involved with testing. So given that you need to, of course, have someone to test, that's the patient. We're going to assume at this point they have symptoms. We first have to collect the samples, and there are two pieces to that. Directly with the person, either an oropharyngeal or nasopharyngeal swab, basically fancy terms for putting a swab towards the back of your nose all the way back to where it meets the throat, or putting it all the way back in your mouth where it meets the throat. And you swab and collect that sample where they believe the virus most resides, and putting it in what we call viral transport media. Both of those things are not easily obtainable. That is, there have been shortages of that. You have to have the personal protective equipment, the PPE, for the person doing the testing to be able to do that. That's not necessarily as readily available. Supplies of all of these things are improving, but they're not to the levels that we'd like them to be. So that's just those aspects. When that viral transport media and collection sample are put together, it has to go to a lab, and the lab has to have the reagents or the chemicals to actually, in a sense, test to detect whether there's virus present or not. The reagents aren't as plentiful because everyone in the globe is also competing for something that, in a just-in-time economy, no one thought you would need this much reagent to be created. And then you have to also talk about how many labs can run this sort of thing. So it's a confluence of so many things that have to come together and be corrected. Having said that, the state has a task force to try to improve those things, and they are very well aware that we are third from the bottom on this, and they're trying to compensate and create more test collection opportunities, testing opportunities. So we will get better, and we share your frustration that we are not where we would like to be.
Okay. So I think we're going to wrap up, and we thank everyone for their questions. It was hard to keep up with the flow of questions coming in via text and via Facebook. I think we did get to most of them, and if there were any specific questions that weren't asked, we'll try to follow up as appropriate through the chat function. And we'd like to remind everyone that there are considerable resources that are available that may in fact address your questions at the arlingtonva.us COVID-19 website, which has been newly reorganized as of a week or so ago to provide better navigation and to be more user-friendly in accessing information. Also, we have our COVID hotline, 703-228-7999. If you have questions about what to do, if you feel sick, you want information about testing, the current state thereof, access to resources, whether it be food or housing, all can be available through there. And, Libby, I think it would be appropriate for you to sort of wrap up with what you'd like to see as far as the new normal. But I'll just sort of say in closing, thank you all. Thank you all for being such good participants in these live updates on COVID-19. It's been about 60 days since we had our first confirmed case in Arlington, and the fundamental changes to the way we operate in daily life has been tremendous. And it's been disruptive to all of us, and it's been devastating, unfortunately, for some of us. So as we continue the fight against COVID-19, it's essential to remember that we are truly all in this together. The actions that we take are not only for our own benefit, but for the community at large. And with your continued patience, compassion, and understanding, we're going to get through this, and hopefully we're going to get through it and be even stronger than we were before.
Absolutely. Thank you, Christian. I don't think I'll talk about where we want to go. I could talk for another hour or so and not quite figure it out. So we won't do that on this one. But I do want to say, one, just real quickly, I started out this year talking about equity. And I think we are working on equity in spades here, working to make sure the most vulnerable among us get through this. And I think we're seeing all kinds of gaps in our safety net and problems with equity that have created problems for all of us. So we need to deal with that. I talked about innovation. I think everybody is innovating all the time. And I do thank everyone also for their patience and their ability to innovate and their good humor as we all try to get through this and make it up as we go along. Nobody's got all the answers. Nothing's going to be perfect because we haven't done it before. So thank you for everybody for that. And then my last theme was resilience. And I do hope I agree, Christian, in the end that we will be more resilient as a community. We will be more equitable and healthier and in a better place, so that we will use this to actually get us to a better place in the end, but we're going to be a while getting there. And then I'll end up, everybody, face coverings, please, 6 feet distance, wash your hands. Thank you so much to our Christian, you for moderating. You do a great job on this. Thank you leading us through this. And thank you, Doctors Miller and Varghese and Jim Schwartz. Thank you so very much for everything you do. I know you guys are working really hard and have been doing it since January at least. Thank you very much for what you do, and onward and upward. Thank you.